My presentation is about managing absenteeism, exploring employee turnover, and retaining staff, specifically regarding nurses. Throughout this presentation, we are going to be discussing reasons for and ways to manage absenteeism. We are also going to take a look at the reasons for which nurses leave their position and place of employment and how to retain staff instead of constantly turning over. Absenteeism is when an employee calls off or doesn't show up for work. There are various reasons for absenteeism, which we'll discuss later on in this presentation. When I think of turnover, I think of someone discussing how a unit has a high turnover rate, which means that the staff doesn't stay on that unit for very long. This is what the book focuses on by defining employee turnover as the number of staff members who vacate a position. Webster's dictionary defines turnover in many ways, but two are specifically related to our class discussion. The number of persons hired within a period to replace those leaving or dropped from a workforce. And two is regarding the movement of people, which is the act of turning over specifically through a position in the hospital. Retention is in relation to nursing and staffing, is keeping a staff member in a position for long periods of time, which most of the literature discusses as typically greater than 5 years. We will discuss each topic and talk about potential causes, implications for healthcare, ways to avoid absenteeism and turnovers, and ways for nurse managers to promote retention for their nurses. Absenteeism can be differentiated in two different ways. The book mentions voluntary and involuntary. Voluntary is choosing to call off for a reason that isn't justified and within the employee's control. For example, if you know that the unit's very busy, you were there the day before, and you feel like you need to take a personal day off. The book uses an example mentioning taking the day off to get something personal done, like your taxes. Involuntary absenteeism is being sick or having an emergent reason to call off. Sullivan describes it as something which is out of the employee's control. Some of the main contributions are present clearly in this quote. Poor health and well-being, pain and disability, nurse depersonalization, burnout, and emotional exhaustion were all linked with higher rates of absenteeism among hospital nurses. Other contributions to absenteeism are the type of job and rate of pay, the employee's specific characteristics, and relationships with coworkers. Sometimes generational relationships can be an issue if longtime nurses clash with millennial nurses who have just started. One problem that can develop and be a huge issue is the concept of an absence culture. Absence culture is the general attitude or tolerance of absenteeism. If it appears to be acceptable to call off whenever, employees will catch on to that and they will not show up for work. And this needs to be addressed and curbed early. One way to manage absenteeism is to identify it before it becomes a serious issue. Look for employees who are experiencing symptoms which identify as unhappy employees and reach out to them. You also want to start by preventing the causes and triggers of the main reasons why employees leave. For example, creating stress reduction techniques, preventing injuries at work, enforcing consequences for workplace violence, provide fair compensation for job titles which are required, and boosting employee morale. Some examples include hosting potlucks every few months, providing quiet zones, getting spas and other relaxing organizations to donate their time, and taking a day to pamper nurses when they have time on their breaks. You want to emphasize the importance of being on time and showing up to work, regardless of what you do or get paid for. And if an employee doesn't show up, is late, or breaks a rule, you have to carry through with the discipline. You want to hire employees who seem like they will be dedicated and stay for a long period of time, and reward those with good attendance. Looking at their resume and how long they have stayed within other positions says a lot about how long they may stay. You do not want to hire employees who seem like they job hop or stay at a position for just about a year. If someone is ignoring the rules you have set in the organization, you want to act early. You don't want to wait until it becomes a habit or fuels an absence culture. Also, as the nurse manager, you want to be a good role model so people can see from you how they should act. That means showing up on time and obeying the rules yourself. Nursing turnover has serious consequences for healthcare, as evidenced by this quote. The excessive rotation of human resources causes an imbalance in the composition of the workforce and incurs costs and undesirable effects both in quality and productivity productivity of nursing care. Turnover spiral is something that may occur if too many nurses leave at the same time. If 2 or 3 nurses leave, it may make things harder for the unit, causing a burden on other nurses, making them want to leave. This can spiral out of control, hence the word turnover spiral. A nurse manager needs to recognize this as it can be detrimental to the unit. Understanding and reducing voluntary turnover is the biggest concern for a nurse manager. Understanding the true reason why an employee left helps provide the nurse manager with an idea of something which may need to be improved. Did the nurse leave for a better opportunity, or was he or she not feeling heard when it came to voicing concerns? There are many contributions to nurse turnover, but this quote names a few. Poor health status, deteriorated mental health, physical injuries, and burnout were all shown to lead to increased nurse turnover. Of these reasons, burnout has shown to be the biggest cause of nurses leaving their position or place of employment. An unhealthy work environment is another issue which a nurse manager needs to address. Mainly, a lack of organizational structure makes it very hard for a nurse to feel like he or she has any say in the care that is provided to their patients. Their concern may not be heard, which can make a nurse feel inferior to staff and management. If a nurse also feels like his or her accomplishments are going unrecognized, he or she may not try as hard and are more inclined to look for jobs which reward and praise their employees for hard work. One thing that is important is adapting to turnover. As a nurse manager, you want to stay in contact with quality nursing staff. That means you can give a list to HR of nursing members who have left but said that you can contact them if you need help on the unit. Another thing to consider is lateral transfers. So if a nurse is not happy with the unit or thriving in the unit where they currently work and you currently manage, you can transfer them within the hospital to another position, which is still a loss for your unit, but it's not a loss for the hospital. As mentioned before, you also want to carefully inspect resumes and not hire any people who seem to job hop or stay in one position for less than a year's time. You also have to account for changes in the economy, as when the economy is booming and there is an influx of nursing positions, nurses are more likely to job hop. Then when there are a few jobs, nurses will keep their jobs because they're fearful of losing one. Something else to consider is having a nursing turnover plan, which distributes the work on the unit fairly and in a healthy way if too many nurses leave and a turnover spiral occurs. That way, too many nurses aren't getting burnt out and decide to leave. Some consequences and implications for healthcare basically revolve around cost. Losing a nurse is a huge cost because hiring a new nurse, there is recruitment, orientation, and training, which costs a lot of money. And then before you actually hire a new nurse, you have to pay the nurses on the floor overtime to fill in their position. And sometimes you have to hire outside temp nurses, which usually make a lot more than the nurses on the floor do, even paying them overtime. Having nurses leave causes an understaffed unit, which leads to decreased job satisfaction because the nurses are overworked, and which leads to decreased patient safety because there aren't enough nurses to care for the patients currently on the floor. But one thing that is surprising is that turnover is not always negative. If there's an employee who is not performing well and they decide to leave, it can actually be a benefit for the unit as that frees open a position for a potential new seasoned employee. One way to retain staff is to promote a healthy nurse-manager relationship. So as a nurse manager, you want to be open and confident, but also transparent with your staff to let them know that they can come to you with any concerns. You also want to make sure, if you can, to compensate your nurses accordingly. As a nurse manager, you should praise good behavior and punish the negative. So while making sure people aren't disobeying the rules of the unit or the organization, you also want to make sure that you're praising good behavior, because if not, nurses can feel left out. It is important to encourage that the hospital obtains magnet status because it has said that a hospital with magnet status increases the job satisfaction for the nurse, which retains them for longer. And you also want to create a healthy work environment. One way for a nurse manager to retain new employees is by presenting the job realistically. When a new nurse comes in for an interview, you don't want to sugarcoat the job. You want to be transparent with them and present all of the options and the job tasks realistically so that in the first few weeks or months of employment, they're not shocked by what they're actually experiencing. One thing that's also really important for managers to know is that they can use onboarding, which some hospitals use to help welcome new hires onto the unit. One way is precepting. Another way is creating fun rewards for them to help them feel welcome, such as a dessert day or a potluck. You also want to recognize new employees if they're doing well, if they're progressing, check in with their preceptors, and give them some personalized feedback. Also, you want to give employees some time off if they have the time accrued in their paid time off bank. Give them a day off every once in a while to help them take care of themselves. If the hospital allows, another huge way to retain new employees is by giving sign-on bonuses. Many sign-on bonuses require a couple of years at the hospital, and it's a good way for employees to be sure that they will be staying on your unit. Here's a video providing the top 10 causes of absenteeism. They mention many of the ones presented here. I'm just going to skip this part. Oh, I guess not. So as you can see, many of those reasons are ones that we discussed in the presentation. Some of them are voluntary, some of them are involuntary, but the voluntary ones should be discussed. Here's a prime example of an employee engagement survey. A nurse manager can send these out to staff members to see how happy they are with their job. They could see direct feedback and make changes accordingly. If you pause the presentation, you can take a quiz to see how happy you are with your current job. One important piece of information regarding staff members experiencing life events or serious illnesses is the Family and Medical Leave Act, which protects individuals if they need a leave of absence for up to 12 weeks. It is typically seen when a woman gives birth. She is provided with the time off, and the job is secure and guaranteed when she returns. Health insurance is also protected during the leave, and the employee is not subject to absence policies of the organization. I hope you have found this information interesting and applicable to where you work. Nurse managers can use this information to help decrease turnovers and increase the seasoned staff which they retain.